Well, the community paramedic program is important because there are a lot of patients in our community that are completely lacking support, like somebody to come check in on them when they're not well, to make sure they're taking their medications the way they're supposed to, and following through with their medical care.
Meredith chose to work with Madison Fire Department because the fit was already there. We're long-standing partners, both as a public safety agency and then as a community hospital. We know that in the Madison community we've got just a number of really wonderful programs that work with a similar patient population. Here we're able to bring everybody together and make a lot of those connections that aren't pre-existing.
Up to 15, 20 times a year that a patient might be in our emergency department. And at times it was things that maybe could have been managed in the clinic setting.
If we can find ways to reduce hospital admissions, the need to call 911, to help people live healthier lives, in using the tools that we have and the knowledge that we have, that's exciting to me. It's exciting to our community.
We came in and said, you know, you're bigger than this. You're better than this. You should want more for yourself than this. You deserve more than this. And you are more than this. And we tell her that all the time. And I think she's starting to believe it. It's the healing power of human connection. It's the fact that we're in there and we're talking and you put your hand on someone's shoulder. You just hug somebody that probably hasn't been hugged in 4 years. To see how far that will take people and giving them a place to call when they have a question has changed people's lives.
We come from the point of emergency medicine. We do a little bit of social work, sometimes a lot of social work, and in particular in the city of Madison where there are multitudes of resources for these folks, we try not to overlap with all the different resources there are. And then we really are kind of like these folks' friends, or their advocates.
Barrier meets regularly with the paramedics that are involved, and we review each case and make sure that we're exploring other potentials for resources and just assisting with troubleshooting.
We've been sharing information. We have an ER doc, we have ER nurses, we have staff, we have paramedics, we have chiefs, and we have the resource of finding out a whole lot more about these patients. And then we can turn around and share what we know about social aspects or family aspects or emotional aspects. And we can turn around and share those with the rest of the team, and I think it's invaluable.
We see it changing by having our paramedics who really have the medical skills. They know the community. Getting out and being in the patient's own environment is huge, we think, in terms of where healthcare is going. They've also seen a tremendous decrease in those type of calls.
The core and what really makes that benefit is the fact that the patients are getting access in the time and the place that they truly need it and can receive the best benefit, knowing that the emergency department and the fire department are always there as a safety net at any time.
This is not rocket science. This is about being kind and decent to people and really listening to them and really caring about them. And that's really where it all starts.
And if it helps our community, that makes me proud. It makes me happy.